Al Jazeera's White House correspondent Kimberly Halkett joins us live. She's been covering this. Kimberly, we want to get to the policy, to how Biden and Bernie Sanders think they're going to lower health care costs. Before you do that, rather, we need to explain to our audience, and I'm really curious about this, we need to explain to our audience why the cost of medication is so much higher in the U.S. than it is in other industrialized countries. And if you'll allow me a little personal example, I've lived in Europe, I've lived in the U.S., I've been insured, right, covered for, had health insurance in both. I have asthma. The inhaler that all asthma sufferers need to have, the same basic one, costs less than 10 euros, let's say $10 in Europe. And in the U.S., the same thing was $100. Why?
Yeah, well, we don't have enough time to explain all the reasons, but I can give you a few of them. Because it is so convoluted. That's part of the problem. But here are some of the big reasons why. First of all, there are no price controls in the United States. For France, for example, where I know you've lived before, it has a government that sets limits on exactly how much the drug can cost. That's one reason. That doesn't happen here in the United States. Another reason is there's no central negotiator here in the United States that sort of works with the drug companies to negotiate the price. So here in the United States, the drug companies can pretty much charge whatever they want for that inhaler and say, this is what we're charging. So if they want to charge $1,000, they can. And there's another reason, too, and that is that the U.S. drug companies have found a way, especially with new drugs, to hold on to the, or have a monopoly, if you will, on the patents that are created, and they kind of extend those much, much longer than in other countries, kind of preventing the generic drugs from getting into the market and allowing consumers to have a choice of getting a cheaper drug that is essentially the same, but at a much lower cost.
Okay. Great job explaining how that worked. I wish I'd understood that at the time. How does President Biden, and in this case Bernie Sanders as well, how do they propose to bring down the cost of medication then?
Well, in some ways, it's already been done. At least for some Americans, because the problem is so vast that they've only tackled part of it. And they've done it through legislation that is really groundbreaking. It happened back in 2022. But here's the reason they're talking about it today. Joe Biden doesn't believe he's getting any credit for it, and he wants voters to know about it in an election year. And so that's why he's talking about it with Bernie Sanders. They're trying to make some noise, and they're trying to alert the people that are benefiting from it, namely those who are on Medicare. Take a listen.
For years, people have talked about how Medicare has the power to negotiate for lower drug prices, prescription drug prices the government pays for, just like the VA does when they're able to negotiate medicines and needs for the veterans. But we've tried and tried and tried. And finally, with Bernie's help, I finally got my Inflation Reduction Act, which passed. Bernie helped get it passed. Not one Republican in the entire Congress, this did surprise me, I have to admit to you, not one single Republican voted for it, not one single one, to give us authority to take on and beat Big Pharma.
So the bottom line is the reason they're talking about this is because polls show that voters care more about inflation, everyday costs like food on the table, and those numbers are still high, even if the drug costs are getting lower. And as a result, the numbers for Joe Biden in polls are lagging or tied when it comes to his competitor, Donald Trump, and that is not good for Joe Biden in an election year. So that is why he's talking about these drug costs today.
Al Jazeera's White House correspondent on what is a very important American issue to American voters. Thank you so much, Kimberly.